humanitarian, and I'm 52 years old, and I'm the president of Handle with Care International.
Handle with Care International is a not-for-profit humanitarian association whose members work to help disadvantaged people in third world countries.
Handle with Care International as an organisation was started up to try and alleviate a lot of the problems that the impoverished communities are suffering over here in Indonesia and later on other countries, but for now we're based here.
Who became really passionate about helping other people and the work we do over in Indonesia.
Our members fundraise all year to raise money in order to fund aid trips. During those aid trips, 100% of the money that we raise goes towards helping people in impoverished situations. We don't spend any of our money on accommodation airfares, all of that is self-funded. 100% of the money that is donated gets spent on our development projects.
We've mapped it all and got all the wells, and there's 13 on this side in total.
We are testing the water for clarity and taking a sample of it that we can later plate up and see if there's any E. coli and other coliforms growing in it.
From a medical hygiene perspective, Simon and I have been going in and collecting water samples at the wells that people are using as their primary source of water.
Yeah, this will be the depth of the water. There's no flowing water in a lot of these slums other than maybe a river. They use the water system as their rubbish tip. So to make the rubbish go away, you either burn it or you throw it in the river. And a lot of the latrines actually back onto or are dumped into the water, so a lot of the water that flows is probably used a lot for bathing as well as using as a toilet. So unfortunately the water quality is absolutely horrific. You shouldn't even have one colony of E. coli, and we've had plates that we've grown in petri dishes that have actually just been a completely different colour and we couldn't count the colonies.
We're amazed at how much growth there is at 36 hours. E. coli, and if not that, known pathogens such as Salmonella, Klebsiella, Shigella, and other stuff. We have not come across one well that does not have coliforms of some description or another.
So that's the sort of water that they're dealing with.
These people are using filthy water to drink, to wash their veggies in, wash their children in, wash their clothes in, and wash their vegetables for cooking in.
Some of the problems that the people have are skin diseases and skin issues, and that's probably from washing in the water that is just so contaminated. It is just that bad.
These people are sick, diarrhea is a way of life, and they really suffer in the monsoon season. So we're putting in life straws, and it's fantastic because it's a simple system and the people really appreciate and understand what we're doing for them.
We get those in and they basically are able to sustain a family of 5 people for about 3 years with fresh drinking water with no changeable parts or any other expense to them.
You can put cow manure in and toilet water, which we tried, and it filters out, comes out clean without the bacteria, and it's healthy to drink and you don't get sick from it. So we've focused on installing them and had a training session with a few of our Indonesian friends over here. Went into the slums with our translators and installed them, and the people were really happy and excited about that.
Now we need to get rid of the air that's in the filter.
Yeah.
I've been helping put the life straws in to set them up, prime them, and then through an interpreter instruct the people how they work and the maintenance that they need to do to keep that going.
This is early days yet. We haven't had a month to go back and check on them. We're trying to set up an organization here where when we're back in Australia fundraising, we have people here that are still going into the slums, checking to see if the life straws are still in place, how they're being used, and hopefully we'll get data on if the family's health is improved, which is increasing their ability to work, their ability of the children to go to school, and just the myriad flow-on of having clean water.
We just came in today to check the last of the life straws, and we're coming in with a new shipment tomorrow, and picked up the last of the forms, and somebody wrote on the back "thank you" in English. So they're very, very happy with their life straws, the ones that we've checked today, so they're working well.
Something that Handle with Care feels very strongly about is community consultation. We're not one of those groups that just come into existing communities and tell them what we think they need. What we're doing right now is this is our initial consultation into this community. We're holding a focus group session where we're asking them if they're willing to contribute to a pool of knowledge which we can use to work with them to develop some sustainable development programs. And so there's a two-stage process. Initially there's some community consultation where we speak with the elders and we find some of the basic problems that they feel the people are experiencing, and then we have a comprehensive questionnaire which is totally voluntary. People who don't fill in the questionnaire will still receive aid from us, and the same aid as people who fill in the questionnaire, but what we find is that in most cases people are happy to fill in our surveys and to consult with us because they want to get out of the situation they're in. They want and they need all the help they can get.
I contrast the poverty I see the people living in here with what we call poverty in Australia, and there is no comparison. What strikes me with the people here that are living in poverty, which means they haul water for kilometers every day, they have no access to clean water or medicine, their floors are dirt, they sweep their beds out with a broom every day. Their food is very limited. They're lucky if they have rice for a day. That's poverty. And yet these people have the most fantastic attitude. They are trusting, they're loving, they are so grateful for any help that we give them when we come in.
There's a huge multinational bank and there's people living like this on the other side of the bank wall. It's just very hard to believe.
These people are so deserving. They want to work. They want to better themselves. They care about their children. They know their children are sick, and there's nothing they can do about it. And that really tears me up.
Like this lady here, she had a car accident and she hasn't gone to see a doctor. Her shoulder is broken but mended again. Her arm is broken but mended again, but she's in great pain.
We are exploring avenues of organizations already here that we can team up with so that we're not doubling up on work that needs to be done here.
We started now bringing in doctors on a monthly basis.
Ruma Sahat Madani is a really impressive medical organisation over here.
And everyone who walks into our clinic from Indonesia, they go, it's so clean.
Its cleanliness was just remarkable compared to anything I've seen over here.
Helping bring in doctors and education and helping the people who have no capability of being helped. Nobody ever goes out there.
Handle with Care is able to work with them by sponsoring to look after the areas that we've already gone into that didn't have medical aid.
Set up mainly for poor people, but normal people can use the service as well, and they pay. And the poor people, they become members. Once you become a member, then all your health and your dental and midwifery services are all free.
They go out monthly and they do regular checkups for the children and the adults. They provide medication free of charge, health checkups free of charge for all the people in those communities. They provide a dentistry program and a midwifery program.
We found that a lot of the people in the areas we've been working in, the urban slums, are poor and sick because they've prioritised education, and the number one priority is to make sure that their children's school fees are paid, and they'll go without basic necessities in order to make that happen because they've recognised that education is the key to breaking this cycle.
The East Bali Poverty Project run by David Booth is really well established. It's a bit of a trek out there.
He's a civil engineer and the work that he's done is just absolutely amazing. He's set up schools, he's actually built reservoirs to be able to get clean water supply down to the people.
We went to 3 really well established schools with the kids learning maths, religion, dance, everything, and they seemed in high spirits as well.
We're really impressed by the work that he's done, and he's been able to give us some inspiration, and he's been able to give Handle with Care, just in talking about it, in his approach, has given us valuable experience just in listening to him talk. He's absolute inspiration to people.
I've been coming to Indonesia for 14, 15 years roughly, and in the beginning it was just for a holiday, but then after a while I started seeing all the needs and the poverty that is around, and things started to change within me, and I just wanted to help a lot of poor people.
I joined Handle with Care because I wanted to make a contribution towards helping people, and I didn't just want to give my money and never see it again and just wonder whether or not it worked to make a difference. Handle with Care allows me to physically go to locations and see where my money is going.
I think the difference between our organization and a lot of charitable organizations is that we not only ask you for a monetary donation, which is great, we gratefully accept that, but our slogan is care, commit, and come. If you care enough to commit money, that's great, but if you could commit time, energy, ideas, and love, and then come with us to get hands-on experience, that's what makes the difference between us and other organizations, and I think it changes your life.
Selamat siang! I joined Handle with Care because I'm really passionate about helping other people, especially people less fortunate. And it makes me grateful of what I have.
2015 Graham. Goat. Dysentery.
I joined Handle with Care because I felt like I need to make a difference in the lives of these people, and bringing them fresh, clean water is one way that I feel we can do that.
They'll be healthier, they'll lose less time at work, and more money, and with our life straws, they're going to save so much money not having to buy bottled water.
And I joined Handle with Care because we wanted to do something a little bit different, and that is coming overseas and seeing for ourselves exactly what's going on overseas and being able to help in whatever way we can, whether that be a little bit more than just a financial contribution, but actually putting in the physical effort and time in order to do it.
The people in the slums are not lazy people. They're not people just hanging around waiting for a handout. It's a very different country to Australia, where we have backup, we have support, we have access to Medicare, we have access to Centrelink. If for some reason we end up in an impossible situation, there are government safety nets that can help you. In Indonesia, if you don't work, you don't eat.
Someone who struggles to get by every day, who doesn't know if they're going to make it tomorrow, if they're going to have a meal that night, if their baby's going to make it, if they're going to die during childbirth. A disease that takes a simple needle back home to cure, they die of.
They need basically a hand. That's what they need. They don't have the resources to be able to get themselves out of the situations they're in.
Welcome to Bali, oh, thank you.
I guess if you're aged anything from 8 to 88, I think you can come. I think you could have a great time with a great bunch of people and really be helping other people.
Care, commit, and come and see for yourself where your money's being spent.
People who come on a Handle with Care trip can expect everything. Fun, we all joke around, enlightening, it's raw, but it changes you for the better.
Contact us and come, because it'll be the experience of a lifetime.
Handle with Care International. Care, commit, come.